Hello and welcome, everyone. Thank you for joining us this evening for this Tri-County Health Department COVID-19 update for Arapahoe County. During this call, we're looking forward to providing you with a high-level update on COVID, as well as giving you some practical tips for keeping you and your family safe as we head into fall. We'll also share some important news on vaccines, including an update on the third dose of the Pfizer vaccine. Dr. Douglas will also share some guidelines for parents to follow as kids start to head back to school, and we'll give some guidance for businesses as they navigate this new phase of the pandemic. Now, we know that many of you have opinions about masks, and we do want to hear your opinions, but at the right time. Tonight's town hall is for community members to ask questions about what's going on with COVID-19. Including vaccinations and boosters. So for that reason, we are not taking comments on masking tonight, and callers may be interrupted if this cannot be honored. If you would like to make a comment about masking, you can do so on either the Tri-County Health website or the Arapahoe County website at arapahogov.com. So, if you have a COVID-related question, you can simply press *3 on your telephone keypad and get connected with an operator. Now, first, we want to get to that high-level overview that I promised with the Director of Tri-County Health, Dr. John Douglas.
Thank you very much, Dirk. Good to be with everyone this evening, and I appreciate the time to give the high-level overview. Let me begin with sort of a little bit of big picture stuff, where we stand in terms of what's happening with the pandemic. And before I even get launched into that, let me acknowledge that if you're like me, you're incredibly tired of having to continue dealing with the pandemic after now we're getting on to close to 18 months. I hear this from folks in our community. I hear it from my staff. I hear it from my wife. This is a reality, and I think we're all just deeply weary. And frankly, what's happened over the past 2 months or so with the Delta variant sort of emerging has been a head-snapping turnaround. So that's not to say that there are not ways we're going to move forward, but I just want to level set the probably fatigue and in some ways disappointment that we all have that this has gone on so long. Let me start with Delta. So it's the alphabet letter of the day. This is the variant strain that was first detected in India, swept through India, swept through Europe, has been sweeping across the U.S. for the past 2 months. It now more or less comprises almost all of the strains in Colorado. The reason it's important is that it's more serious. It's at least twice as easy to transmit it from one person to another, so it's more contagious. It appears that it is, at least in adults and maybe in kids, more serious than the previous strains. That data is still sort of coming in from different places, but strong suggestions from a number of countries who are dealing with this before we are suggest that's likely. Thirdly, the vaccines, let me underline this really boldly, appear to work very effectively against Delta. They appear to be about 85 to 90% effective in preventing severe illness, that is hospitalizations, or fatal outcomes, that is death. And they appear to be about 75 or so percent effective in preventing all infections, meaning milder infections as well as serious infections. You will note that 75% number for all infections is lower than the serious infections. And it is true that we do see less protection. Some people will get mild infections. And very importantly, we're now learning that the people who get those mild infections are as contagious to other people as unvaccinated people. They are as contagious to other people as are unvaccinated people. That, frankly, surprising observation is what led the CDC about a month ago to say, it looks like we need to go back to recommending mask wearing in public indoor spaces who have substantial rates of transmission, which is, by the way, almost all of Colorado right now. And we strongly recommend that masks be used inside school settings by all people of all ages, whether vaccinated or not. Now, that was really a big U-turn. I think a lot of people felt blindsided by that, but it was based on this surprising emerging data that was coming out of Delta. Now, where do we stand in Arapahoe County? What's going on in our county really mirrors what's happening in Colorado. We've seen rate increases over the past 4 weeks, for example. We've seen an over 120% increase in numbers of cases per 100,000. Over the past 2 weeks, we've seen about a 30% increase. There may be a slight slowing going on. I certainly hope so, but we are still seeing an increase. Hospitalizations across the state are rising. Fortunately, they are almost all in unvaccinated people. I mean, that's not fortunate that they're getting sick, but it's fortunate that it means the vaccines really work well. We do have plenty of hospital capacity now, but we watch, frankly, very nervously, seeing what's happening in some of the states in the South that have lower vaccination rates that are jam full. And there are docs and nurses going out saying, please, please, please get your vaccines. We are really tired of having to take care of people on ventilators and incredibly saddened when we continue to have fatalities. So we're experiencing increased hospitalizations. It's a Delta phenomenon, but mostly among unvaccinated people. Now, how are we doing on vaccinations? We're actually doing, I would say, maybe a B, maybe even a B+, but I'd like to see us get to the A level. 67% of the residents of the county have gotten complete vaccinations. That's great. In our younger people, it's lagging, but still good. 12 to 15-year-olds, 50%, 16 to 17-year-olds, 61%, 18 to 29-year-olds, 54%. If you're in those age groups or have friends in those age groups, please, please, please think hard about getting a vaccine. We've had some evolving news on the vaccine front lately. Just a couple of days ago, the FDA announced that we had licensed the first vaccine. That is a vaccine that's not being used just under emergency use authorization, but it's gone through every approval hoop, all the I's dotted, all the T's crossed. So the Pfizer vaccine is now fully licensed. We expect that's probably going to happen soon for the Moderna vaccine as well. Number two, the CDC recommended about a week ago that persons with a variety of different conditions suppressing their immune system would benefit from getting a third dose. And folks who've got a variety of conditions in that category should be talking to their providers about getting that third dose. Thirdly, toward the end of last week, Health and Human Services announced they thought data was becoming compelling enough regarding boosters. Boosters means getting an extra dose on top of the original regimen that you got, that probably by the end of September, folks who'd gotten a vaccine 8 months or more ago ought to get a booster. That's going to be many of us in the weeks to come, although the official language about how that ought to be done is still pending. And then finally, if you're like me, if you've got kids or grandkids, you really want to know when might a vaccine become available for our kids. We're still hearing various age ranges, or rather various time ranges, and those go anywhere from beginning of October to the end of December. Now, let me say a couple of words about parents. Schools are back. It's fantastic. They're going full speed ahead. What should you as a parent do and expect? If you've got the chance to have your child vaccinated, please do so. Please be aware that we are strongly recommending masking in schools, and in fact, as I think almost everybody knows, our Board of Health recommended that masks be mandated in schools and child care centers. Now, this has been somewhat confusing because 2 of our counties have chosen to opt out of that recommendation. While I am disappointed by that, I am really pleased that many of our school districts, bolstered by that recommendation by our Board of Health, have gone forward and begun to require masks. I think that's going to stand us in very good stead. The primary reason we're recommending masking, by the way, is to keep transmission in the classroom down and keep kids in class. Because if you get sick, you got to stay home. If your class has an outbreak, you may have the class canceled. We've already had 38 outbreaks in the schools across our 3 counties. 9 of those have occurred in Arapahoe County, and they're increasing over the last couple of days by about 20% per day. So what we feared could happen is beginning to happen, and that's why the mask wearing is so important. Thirdly, if your child is sick, please keep them home. And if they have symptoms compatible with COVID, please get them tested. And then finally, if your child does test positive, isolation at home is a public health requirement. We just don't want those kids to be in school and potentially exposing other people. Let me just close because, again, I know, as Dirk said, there's a lot of interest in masking. Our big rationale is keeping kids in school. We also, of course, want to keep them healthy, even though COVID has thus far not made kids as sick as adults. The third reason is we want to keep the kids from transmitting infection, if they get it, to their parents, if their parents have, or family members have health conditions that might put them at greater risk. So, Dirk, let me wrap up the overview and turn it back over to you.
Thank you very much, Dr. Douglas, for that very informative overview. Now, we'll get to tonight's business update in just a few moments, but first, we'd like to take a few questions. As a reminder, if you'd like to ask a question of Dr. Douglas, all you need to do is press *3 on your telephone keypad. So our first caller, we've got Laura joining us live. Laura, welcome to the call. Go ahead with your question for Dr. Douglas.
My question is, I'm high risk for COVID. I've got like 3 of the health issues on the list, so I'm high risk. And I did get my vaccination, both of them. But on the second one, they said it wouldn't be fully effective because of the medication I was on at the time, and they couldn't tell me how much not effective it is. So I'm wondering if that qualifies me to get the 3rd dose now. I stay home, I don't go anywhere, but sometimes I have to go somewhere like the doctor or the dentist, or I had to have work done in my house. And even when I tell them everything I just told you, and they agree to wear their mask, if they're in my house and it's in the contract, and they think I'm not looking, they take it off. And then my dentist and my doctor aren't following the rules either with the mask, or maybe there's not a rule anymore. But, I need to be able to just do the minimum stuff. Like I can not go to the store or see any people, but I'm wondering if that qualifies me to get that 3rd, booster shot.
Yeah, Laura, thanks for that really important question. By the way, I've got a family members in a similar circumstance. You're very sympathetic. I would say that I don't know what med you were on, but if your doc told you it might have affected your vaccine response, please call your provider. I think you might be eligible for that 3rd dose now. And, of course, it sounds like you're being quite cautious wearing masks. Healthcare providers, dentists, and docs are supposed to wear masks in the office. If you're in a place that's not happening, I think I would courteously ask the provider to do that.
Thank you very much, Dr. Douglas. And moving on, I've got another question here. We've got Robert joining us to ask. Robert, welcome to the call. Go ahead with your question, please.
Hello there. I was calling, or basically wanting to ask you that if having a slightly elevated white blood cell count would show that the vaccination would be kind of wearing off on you. I got my vaccination back early February, and I guess early March was my 2nd shot of the Pfizer, and I have. And my doctor told me this week anyway that I got a slightly elevated white blood cell count, and they want me to come get it checked out again in like 4 or 5 weeks, see if it settles down. But I heard that the minor bacterial infections could happen when the vaccine begins to wear off. Is that true?
So, Robert, the vaccine losing effectiveness probably shouldn't increase risk of bacterial infections, and it really shouldn't increase a risk of your white cell count being elevated. So there may be something else going on. Hopefully it's nothing serious, but I don't think it's likely to be related to your antibody level dropping. But if you did get the vaccine February and March, you're probably going to be someone who apart from your white cell count, ought to get a booster in the near future. Again, we'll wait for that specific advice from the CDC soon, but just be alert to that.
Thank you very much, Doctor. And we've got another question here. Moving on, we've got Thor joining us. He's got therapeutics on his mind. Thor, go ahead with your question for Dr. Douglas.
Hi, thanks for taking my call. My mom is in memory care, and she's caught COVID and recovered, thank goodness. She's had 2 vaccine shots, and everything's going well, but she is in a comfort care leading up to so I go and visit her on a daily basis, and I've been vaccinated, but I was a little concerned if she gets it again. If either of us get it again, is there anything we could do short of like waiting until we're serious and end up in a clinical setting, because she's not supposed to leave the small memory care facility with about 10 residents because she's under comfort care heading towards hospice care. And so I see her, and we're both at a little bit of a risk because of all of that.
Yeah, thanks, Thor. Really good question. I would say that while there's a lot of work going on developing antiviral drugs, we're not nearly as far along with treatments, if you will, as we are for bacterial infections that Robert was talking about. However, there are monoclonal antibody infusions that folks who get ill with COVID, who are not ill enough to be in the hospital, can receive, that does appear to reduce the risk of serious outcomes substantially meaning about 70 to 80%. So it absolutely, from your mom's perspective, worth asking about that. It turns out that same infusion has now been recently authorized, emergency use authorized, to be given prophylactically, meaning you got exposed and you're worried. We're largely using that in unvaccinated people. But so I think that the value of those are going to be mostly if one of you gets sick. But just be aware, the notion that COVID is untreatable, all you can do is just wait and hope you don't get sicker, is really changing.
All right, Doctor, moving on, we've got Melissa joining us on the line. Melissa, welcome to the call. Go ahead with your question, please.
Hi, Dr. Douglas. I was calling to find out statistically what is the risk, because I've read some literature in terms of what the side effects for 12 years old and up getting vaccinated. I have a 12-and-a-half-year-old son, and I'm concerned because they keep talking about how it's causing kind of brain issues with them. So what are those statistics, if you know them, please?
Melissa, if I could clarify, do you mean problems after the vaccine or after the infection?
After the vaccine.
After the vaccine.
Yes, sir.
So the brain issues that have been described after the vaccine are really quite limited. They are vaccines related to blood clots. Those have been pretty strong to be associated with the Pfizer vaccine. They are very uncommon to start with, about 1 or 2 per million, so keep that in mind. Secondly, they are more common in older folks than younger folks. I think for someone in their teens or so, the risk of that, I can't quote you an exact statistic, but it's going to be less than the 1 or 2 per million that we see overall. So I think that while we continue to watch for new side effects to develop, brain or neurologic side effects that have been very likely associated with the vaccines have been very rare. I do want to point out something that's probably worth mentioning, that while kids don't get as sick in terms of hospitalization as adults do, there is a condition called long COVID, where people get COVID, they may not be that sick, but then it takes them a while to recover. And one of the symptoms of that can be what's called brain fog. People just don't think as clearly. That doesn't seem to happen in kids as much as adults, but it can. So things to think about, but I don't think any of the neurologic concerns would sway me recommending that your 12-year-old be vaccinated.
All right, Doctor, our next question comes from Gene and Aurora. Gene, welcome to the call. Go ahead with your question for Dr. Douglas.
I was asking, do you still think we need to do a flu shot?
Gene, great timing. Thanks for asking me that question. Absolutely, 100%. The flu was historically low last year. We have never seen such a low year in terms of flu, but that's almost certainly because we spent the whole year kind of not moving around that much, not hanging out with other people, maybe not going out. Maybe we wore masks. I hope we did in public places. And we had a remarkable preventive effect on the flu. But we're really quite concerned that we could have a bad flu year this year. So I would unequivocally get the flu shot. And if you haven't had the COVID vaccine, or if you're due maybe in a month or so for the booster, that one is highly recommended as well.
Thank you for taking these questions, Dr. Douglas. I'm going to give you a moment to catch your breath as we now turn our attention to the business world and get an update and take some questions for Melissa Sanger, the Policy and Intergovernmental Affairs Manager for Tri-County Health. Good evening, Melissa.
Thanks, Dirk. Happy to be here. And I have a few things to talk about with businesses. I'll start with masks, since that seems to be the trend of the evening. Like Dr. Douglas mentioned, the CDC has recently recommended that folks in areas of substantial or high transmission wear those masks indoors. And so if you're a business that feels comfortable doing so, the Tri-County Health Department has some template signage you can hang up on your door to require your customers to wear those masks in your place of business. We're also talking to businesses quite a bit about the vaccine, also a theme for the evening. We're working with businesses to ensure the vaccine is accessible to their employees. For some, that looks like an on-site clinic. For those big businesses, they have a lot of employees that they can bring in at one time. They have the space for that. For many, many other businesses, it looks like making sure your paid leave policies are up to par. You're allowing your employees to take time to get the vaccine, and certainly assuring your employees that they have time should they experience symptoms after that vaccine. And so we're working with them to provide that information, to provide information on where to get the vaccine, educational materials to provide employees. And so if you're a business interested, please reach out. We're happy to connect you with information. And then lastly, just wanting to talk about paid leave. We have the Healthy Families and Workplaces Act here in Colorado. And what that act says is that if you're a full-time employee, you need to have 80 hours of paid leave in a public health emergency. And that's true of COVID in 2021. So full-time employees, employers need to provide that 80 hours of paid leave, and that can be used not only for having COVID, so if you need to isolate because you've tested positive, or you need to quarantine because you've had contact with someone who's tested positive, but it's also to get tested or get the vaccine, recover from any vaccine side effects, and caring for a family member that may be sick with COVID. That leave continues as long as the COVID-related emergency is in place. And right now we have a federally declared emergency for COVID-19. And so all employees need to have that 80 hours, and then it's prorated for those part-time employees. If you're an employer or employee with questions about that, the Colorado Department of Labor has an amazing fact sheet that walks you through that information. They're pushing out that information to businesses. If you're a business, you can reach out. You can also reach out to us here at the Tri-County Health Department. And then resources, check out Tri-County's business support page. Again, the Department of Labor, the CDC, CDPHE, lots of great information for handling COVID in the workplace, working on vaccine, keeping your customers and employees safe. That's it for me, Dirk.
Thank you very much for that information, Melissa. And now we have Melissa on the line with us. Let's go ahead and take a few business-related questions. Again, if you have a question you'd like to ask, you just need to press *3 on your telephone keypad. Again, press *3 to get into the queue to ask a question. And Melissa, the first question for you comes from Fred in Arapahoe, who's got some football on his mind. Fred, go ahead with your question, please.
Yes, hello. My question is, with large outdoor events like NFL football games this weekend in Denver, what is your recommendation for mask wearing in that situation?
Thanks for the question, Fred, and it is the season. Right now, mask wearing is not recommended for outdoors. With that, when you're arriving in a very crowded place, like to go see a Broncos game, you might want to wear that mask as you enter the stadium, you're in line, even if you're outdoors. And then those concourse areas can be crowded, and because they're more indoors, that's a little risky. And then even out in the stadium, activities like shouting very loudly can create increased aerosolized droplets that spread COVID. And so to be extra safe in those higher risk settings, again, those tight, crowded places, the lines, the concourse, and if you're going to be around folks shouting, you might want to put that mask on, especially with Delta, as an extra layer of protection.
Thank you for taking that question, Melissa. Our next question comes from Beth, who joins us now. Beth, welcome to the call. Go ahead with your question, please.
Thank you so much for taking my call. I teach kid yoga, ages 3 to 10, at a fitness facility. My employer is telling me I do not need to require the children to mask. I completely disagree with my employer. I required the children to all be masked to come to my class yesterday. I was told in writing today that that is not required because the fitness facility is not a school or a child care facility. But there's a line in the Tri-County wording that says single skill, extracurricular, something about a single skill building activity requires masks. And I was hoping to find some clarification because I don't want these children not to be masked in my indoor yoga program, ages 3 to 10, with kids coming from all different schools, all different districts. I think it's completely immoral, unprofessional, unethical to have them unmask my class.
Beth, I really appreciate the question and wanting to keep those spaces safe, especially when working with those kiddos as we get back to school, like you mentioned, really wanting to keep that in-person learning secure for all of our kiddos. If you can reach out to us with some specific details, I will say you are absolutely correct. Those single skill building, we call them camps. If kiddos are being dropped off, parents aren't there, they're left in your care, those are license exempt child cares. And so they don't require a license, but they do require compliance with the masking order. It depends on your situation, and so I'll need a few more details. But certainly when those kiddos are exercising, and like you mentioned, in those indoor spaces, it can be riskier. And so if you reach out, I'd be happy to take a few more details from you about your specific situation, and we can help you navigate that. But those single skill-based child cares, those license exempt, masking is required in those settings.
All right, moving on. We've got Margie and Aurora joining us. Margie, go ahead with your question. You're live on the call.
Thank you so much. This is probably more for Dr. Douglas. Unfortunately, last week, one of my neighbors was diagnosed with active COVID, and his wife didn't take the test at the time, so she did later on in the week. But on the day of his positive diagnosis, a Tri-County health representative called them, to do, I think, contact tracing and that kind of thing. But they were told it was okay to go to church and to go to the grocery store. And I'm kind of baffled by that because I thought we were encouraging people to quarantine. So I'm just wondering, just briefly, what is the protocol when someone is diagnosed from the Tri-County Health perspective, please?
Sure, Margie. Let me take that one. Your perplexity is understandable because I don't think your neighbor, if that's how they heard it, got the right advice. We would tell someone who tests positive for COVID to stay home. That's called isolation. We typically ask them to stay home and stay in isolation until a week after their symptoms have cleared, so after their fever's gone, for example. That would include not going to church, not going to the grocery store, even if they wore a mask. I'm a little curious as to whether or not they may have given slightly different advice to your neighbor's wife. She would be a contact, and until she was positive, while she should be careful and probably should mask, if she had not been vaccinated, she would be allowed or not discouraged from going out. And if she had been vaccinated already, vaccinated people do not need to quarantine. So thank you for clarifying or at least asking us that question. We'll circle back to our team and make sure we're not somehow getting our information confused.
Dr. Douglas, thank you for stepping in and fielding that question. We'll get another question here for Melissa. We've got Jackie joining us on the line. Jackie, welcome to the call. Go ahead with your question, please.
Thank you so much for the question. And I first want to start off to tell you I'm totally for masking, so this might make you think. So I own a child care center, and I serve 3, 4, and 5-year-olds. And I did the masking this week, and it was awful because right now we're going through runny noses. And they're at the stage where they don't tell us their nose is being running, and it is all stuck on their face. And I've had like 3 families take their child out for the rest because their child ended up getting a really severe cold. And I'm thinking, was it from them in time from the mask? And prior to this, when we had COVID before and all that, my center did not have not one sickness go through it. I kept my building clean, and I did not do masks through that. I opt out from the mask, kept my building clean. I have OCD about cleanliness. So I have time with masking my children in my center for that age. So can you kind of clarify me if I'm going the wrong direction? Or...
Jackie, thank you for the question, and we know that a lot of our child care providers are in a similar situation, getting these kiddos into masks and keeping those young kiddos in masks may be a new thing for many of them. And so we do have a number of resources on our website to help you navigate that from some of our trusted sources, the CDC, the American Academy of Pediatrics. We know that it can take some work with those younger kiddos, and so our guidance says provide those breaks from those masks, take time outdoors. If you can't get outdoors, have those kiddos do an independent activity away from others. Those masks are most important when they're interacting with other kiddos or adults in that setting. Those masks are safe, and they are a good prevention measure with this Delta variant that's significantly more transmissible. And so that's why we have a bit more worry with these younger, littler kiddos that we weren't as concerned with the first version of COVID. And so those masks are important. We know it can be challenging. We have resources. Reach out. Our child care team that interacts with our child cares regularly is certainly prepping to answer questions about this, and we're happy to help you along the way. Just very quickly about the runny noses, if you can get parents to bring an extra mask, certainly if those kiddos are ill, you want to keep them at home, maybe it's allergies, maybe some disposable masks for those kiddos. But again, reach out. We're happy to help you through that. You can give Tri-County a call at 303-220-9200.
Great. Thank you very much for sharing that number, Melissa. And let's go ahead and do one more question for you, Melissa, and then we'll bring Dr. Douglas back in and do more questions for both of you. So our next person with a question that's joining us is Kristen in Littleton. Kristen, welcome to the call. You're live. Go ahead. Hello, Kristen.
Oh, hello. I'm sorry. I am in a organization that is starting up live meetings again, and they have 15 to 20 people come, and we do a pledge all together, and the recording secretary reads the minutes. And what is the protocol to that? Should we have a recording? Should it out or what?
Thanks for the question, Kristen. I'll mention a few things. I mentioned this before, but the CDC is recommending those masks in indoor spaces for substantial or high transmission, and we are in that space now. And so you want to be wearing your mask in that setting, vaccinated or not, recommended for everyone. Again, that Delta variant being more transmissible. You want to make sure you have your booster shot if you're eligible for that now. Those activities are permissible. There aren't many restrictions on businesses. You want to stay home if you're sick. You want to make sure other people are staying home if they're sick. But you can engage in those activities, and people are. You just want to do take that extra layer of precaution right now. Wear that mask. Make sure people that are up there presenting, you can say the pledge. If you can distance yourself a little bit in the room, 15 to 20 people, not that many, space yourselves out a bit. You can be doing that. Just take that extra layer of precaution with the mask.
Thank you very much, Melissa, for that answer. And as I mentioned, I think it's time now to open up the questions for both Melissa and Dr. Douglas. If you have a question you'd like to ask, all you need to do is press *3 on your telephone keypad. Again, *3 to enter the question queue. And Dr. Douglas, we've got one for you. We've got Jay from Aurora, who's joining us now on the line. Jay, welcome to the call. What is your question?
First of all, thank you so much for taking your personal time to do this. I'm so proud to be living here in Arapahoe County and to have you guys speak to us. So my question is twofold. First of all, what if someone had COVID, wore a mask, did all the protocol, still got COVID, even though they wore masks, and recovered from COVID, and now has natural immunity? Do they still need to get vaccinated? And the second, I'll let you answer that first.
Sure. The quick answer is getting COVID does confer some natural immunity. It has been hard to predict how much. There are some people who get, it looks like, immunity that may last 6 to 9 months or so. There are others who appear to get a very short burst of immunity. The rule of thumb has been if you have had COVID, you're probably protected for 3 months or so, but that because the duration is unpredictable, it's still a smart idea to get the vaccine on top of it. By the way, if you've had COVID and get the vaccine, while you were unlucky to get COVID, you're going to be lucky with your vaccine because you're probably going to get a better immune response.
I learned the science part. Okay, thank you.
All right, moving on. We've got Diane from Inglewood who has a question and would like me to go ahead and read the question. So, Dr. Douglas, in the case of a breakthrough for those who have been fully vaccinated, are they just as susceptible to the long-haul symptoms of COVID?
Boy, that is such a great question, and the answer is we don't really know. The best thinking is probably not, but I will have to tell you that the study of long COVID is very much in its infancy. It took us like 6 months after COVID hit the scene to begin to realize that there were these people having long-term symptoms. and we're only now beginning to see well-organized studies being conducted to try to assess it. So my best thinking would be, because most manifestations of COVID are milder in the vaccinated, that will probably be true for long COVID, but that's very much a work in progress to figure that out.
Thank you very much, Dr. Douglas. Moving on, I've got Chris in Aurora on the line now. Chris, welcome to the call. Looks like you have a question for Melissa. Go ahead with the question.
Yeah, I work in a large company that successfully worked remotely for 18, 19 months. When the restrictions were lifted back in May, the company started moving people back on site. And first of all, the parameters were not even with regard to masking, where masking, how often, where do you do it, so on and so forth. Ability to, distance was lessened because you had everybody in at the same time, so on and so forth. With this Delta variant sweeping the way that it is, and all the rigmarole that's going on with schools masking, not masking, so on, why is there not a focus on these companies that if they do not need to be in a building, that they are told, don't be in a building, go work remotely, keep those vectors down, and keep those avenues of transmission out of the mix?
Chris, thanks for the question, and it's a tough one. We still are strongly encouraging our businesses to implement those mitigation measures that we know work. Distancing, if you can do that remote work and your employer is open to that. We have resources for our businesses to describe the benefits. There are resources out there on how to implement more remote work. They should be implementing mask wearing. We have resources for that as well, and we'd encourage you to connect your employer with that information. We are happy to connect with your employer about that as well. Certainly, like you mentioned, with Delta spreading, it's important to take those mitigation measures, make sure you're vaccinated, make sure you're wearing your mask. Right now, it's only required for those medical settings, as Dr. Douglas mentioned, and a few other settings, not required more broadly. But our businesses should be implementing them. We're happy to help you. We're happy to connect you with resources, and certainly your employer if you can make that connection. So reach out to us. Happy to connect you with that information and provide some additional details.
Thank you, Melissa. And I've got an online question that I would like to point your direction now. This was submitted by Tim, who says, we're having a big social event in our home tomorrow evening in Centennial. What should our mask protocol be?
I'll just mention that CDC guidance, again, recommending that individuals, vaccinated or not, wear those masks indoors. Certainly if you're home with your family, that's one thing. If you're going to have a large group of people over, that's a little different. We recommend you get outdoors if you can. Take that celebration outside, set up your activity outside, significantly safer than indoors. Open your windows up. It's a lot of those things that we were doing just a few months ago that we know work. Increase that air circulation. If you're going to be indoors without that good ventilation, it is recommended to wear those masks, especially when you're not going to be distancing with your close family, likely going to be gathered closely.
All right, going back to the phones, we got a question for Dr. Douglas, and it's from Patty in Aurora. So, Patty, welcome to the call. Go ahead with your question for the doctor.
Hi, thank you. I had read somewhere that there might be some heart issues as a side effect related to the Moderna vaccine. And I was wondering if you had any more details on that, any information.
Yeah, thanks, Patty. There has been a condition called myocarditis, inflammation of the heart muscle, associated with both Moderna and the Pfizer vaccine. Seems to be more common in men than women, seems to be more common in folks in their teens and their 20s than in older people. It was a little hard to sort this out when we first began to recognize it, because it turns out while this is not common as a condition in general, it is caused by a number of different viruses in the community. And so certainly folks periodically, influenza, for example, can cause myocarditis, can get it from other reasons. But it does appear the vaccines do cause a slightly higher risk. We're talking about on the order of, 1 in 100, 200,000. And it's quite clear that when you balance that versus the risk of outcomes from COVID, it very much weighs in the direction of the vaccine being favorable and strongly recommended in that age group. It is, however, one of the reasons that the FDA may take a little longer in evaluating vaccines for 5 to 11-year-olds. They want to be sure they've got a really clear idea about whether that particular condition, which was again has been seen in teenagers, is going to be an issue in younger children. So in summary, yes, it's been seen, both Moderna and Pfizer, quite rare, certainly overbalanced, especially with the Delta infection, by the benefits of the vaccine, but certainly something that providers and parents, if you've got somebody who's young enough to get it, ought to be at least aware of.
All right, we've got another question for you, Doc, and this one comes from Bill. Bill, welcome to the call. Go ahead with your question, please. Hello, Bill. Looks like we might have lost Bill. We'll try and get him back here. We'll move on. We've got Brian in Littleton. Brian, welcome to the call. Go ahead with your question for Dr. Douglas.
Thank you for taking the call. My question is, my wife is due to get her booster shot, Pfizer booster shot, tomorrow morning. We'll be getting our flu shots probably in September. I was wondering if there's any problem with, the proximity of the timing with the two shots together. Thank you.
Thanks, Brian. This is a timely question because it is, we're getting onto flu season. Both the flu vaccine and the COVID vaccine can be administered together. So there's no reason from a blocking the effect of one vaccine or another. And there does not appear to be any kind of double compounding of side effects by getting them either together or back to back. However, I would make note that some people do get, a pretty achy fever, wiped out for a day or so after a COVID vaccine, and some people get the same thing after a flu vaccine. If you've only got one chance to get them both, I think it's okay to get them together. If you've got the luxury of spreading them out a week or two, I think that might be a good way to just potentially modulate side effects and don't get 1 + 1 = 2.
Thank you very much, Dr. Douglas. Moving on, we've got Eric joining us from Inglewood with a question for Melissa Sager. Eric, go ahead. You're live.
Yeah, where are we at as far as city and county and corporations requiring proof of vaccination to retain employment? I was watching on the news that the city and county of Denver is requiring all their employees to have this. If not, it could lead up to termination. The reason I ask is I run the Federal Express Center here in Commerce City. I have a little over 200 employees, and half of them are not vaccinated, and they have no intention of doing so. But my corporation is getting ready to mandate this, and I would hate to have to fire half my employees. Is the situation that bad that we are at this level?
Eric, thanks for the question. It's a complicated issue, and we know that folks have a lot of feelings about these requirements. What the federal government has said is that it really is up to the state as far as who can require vaccine, both for employees and customers. And here in the state of Colorado, we do not have any restrictions on businesses, those private businesses, or employers requiring the vaccine for their employees or customers. And so businesses can require that vaccine for their employees as a condition of employment, and they can make termination a condition. We have lots of resources to help you have those conversations with your employees. We're happy to connect you with resources. We know many businesses, you mentioned the city and county of Denver requiring, many businesses are taking this approach to keep their place of employment safe for everyone. And so it is allowed here in Colorado. We are seeing many businesses, even our local governments, requiring the vaccine. Again, we have those resources, lots of educational materials, incentives to get the vaccine. The state is giving $100 gift cards at their state vaccine sites where your employees could go. And so if you have questions, if you have concerns, we do think many employees are on the fence that they may be willing to get the vaccine just because it's required. And again, we can help you have that conversation with your employees. But it is allowed, lots of resources out there to help.
All right, we're heading out to Bennett now, where we've got Carol joining us on the line with a question for Dr. Douglas. Carol, go ahead with your question, please.
Yes, my granddaughter and I are planning a trip to UK next July. It had been postponed from this July due to COVID, and I know in the UK the COVID has been quite heavy. I have COPD. As of next month, I am eligible for the booster, but how long is the booster effective? Should I wait longer, or what should I do?
Carol, a really good question. By the way, I want to take my granddaughter to the UK, so I'm jealous. I think it's a little early for us to tell how long the boosters are going to be active. If you've got a condition like COPD that might make your ability to handle COVID more problematic, I would unequivocally get the booster as soon as it's available to you. And as soon as it's recommended. You might need another booster. Next July is, again, 11 months away. You might need another booster before then, but you obviously want to stay as healthy as you can so you can plan that trip. So I would get the booster. We'll be learning how long they last. And we'll also be learning, by the way, how things look in the U.S. versus the UK by then. So obviously things can change a lot in 11 months.
All right, moving on for our next question. It looks like it's actually for Grandpa Dr. Douglas. We've got Lynn in Denver joining us. Lynn, go ahead with your question.
Yes, thank you. My question is about protection, being a grandparent, a grandma. I am fully vaccinated and I'm generally healthy, but I have a grandson who is 11, so he is unvaccinated. He goes to school in Denver County, so he, mandatory mask when he's at school. But when he's away from school, I just want to know what I should do. Should I wear a mask when I'm indoors with him? Should I be conscious of social distancing when I'm indoors with him? Should I avoid being around him altogether? Can I not wear a mask when we're outside? Any advice you have on that, I'd really appreciate.
Yeah, Lynn, this is such a great question. Well, first of all, don't not be around him. That's absolutely not the right choice. I think the information we have right now, and I would say this in bold caps for someone who's going to school where the masks are required, like in Denver, is that your risk is likely to be pretty low, not zero, but pretty low, both because you've probably got a pretty high level of protection. Secondly, while he certainly could be exposed in other places, the reason schools have popped up as being a big area of concern is that's where kids are gathered together quite closely. I think what I would say is I wouldn't recommend that you wear a mask with him at this point in time. I would recommend that you ideally visit with him if possible as the weather's warm and in spaces that are well ventilated. But, if he's coming over for dinner, have dinner with him. If he wants to spend the night, have a spend the night with him. I think at this point you can pretty confidently interact with him given your vaccination status.
Thank you very much, Dr. Douglas. And looking at the clock, we have time for one more question. And we've got Lavana joining us now with a question for Melissa. Lavana, go ahead with your question, please. Hello, Lavana. Looks like we've lost Lavana. We'll try and see what we can do about getting her question answered once this call ends. So we'll move on here. We've got next up Linda with a question for Dr. Douglas. I apologize, my control panel is frozen on me. So Linda, can you hear me?
Yes, thank you very much for taking my question. I really appreciate it. I actually have a quick two-part, well, hopefully it's quick, two-part question for both Dr. Douglas and Melissa. I was infected over a year ago with COVID at a doctor's office, and I have been dealing with long COVID since. I was isolating before that. I've been isolating since as much as possible. I rarely go out. However, I run my own business. I've not been able to be vaccinated because I'm allergic to the ingredients in the vaccines. I wanted to see if Dr. Douglas had any idea when the Novavax vaccine might be available. I should be okay with the ingredients in that vaccine. And then I also wanted to ask Melissa, I've been trying to contact my representatives, both local, state, national, with no success at all, to try to get some assistance, some financial assistance. I've applied for grants, loans. With no luck, I've been locked out of, I'm a massage therapist, I've been locked out of pretty much everywhere that I was working, everywhere public that I was working. And I've not been able to work much because of the long COVID symptoms and what I'm dealing with, and also because of the situations with my clients. And of course, I'm taking all precautions for both myself and my clients, but things are very difficult. So I'm wondering if there's any hint on the horizon of possibly a PUA extension, any kind of assistance for those of us that, you know, especially with the extreme situation with the Delta, and the fact that things are not back to normal by any stretch and seem to be getting worse, if that might be reenacted.
So,
Dr. Douglas, can we call on you first?
Yeah, let me start. Linda, I do not know the status of Novavax. I am guessing we're probably talking about the next 4 to 5 months or so, but I'll have to confess I'm not super up to speed on that. However, I am a little intrigued by your history of allergy to the ingredients. I don't know if this is polyethylene glycol, but if this is not a pretty well worked out serious allergic reaction, I'm actually wondering if you might see an allergist to see if there's any way to even desensitize you. I'm saying that in part because Delta's a concern, number one, and number two, there does seem to be some early information that vaccinations help people with long COVID, and given your suffering, this could almost be a kind of a double benefit to you. So I'll transition to Melissa.
I feel bad because I also am not going to have a ton of information for you, but I do have a little bit. For those funds to support you and your business, reach out to us, 303-220-9200. Curious to get a bit more information as far as there are state resources, unemployment benefits for folks who have lost hours due to COVID. Your local governments also have resources, and so I do encourage you to check out your local government's resources, the county, Arapahoe County, but also your local cities, different programs going on, the Small Business Administration, your local Chamber of Commerce, your local economic development offices, all working very hard to make connections to all of those resources, whether it's directly through them or through other programs that they can connect you to. So I encourage you to reach out to us, but also those state resources, your local governments, those business resources compiling a lot of information for business support.
Hey, can I
so
throw
as
in
we
one more
approach
thing
the
real quick?
end of our
yeah,
yes,
I just wanted to say, Linda, if you, I assume you, again, I can't consult with you clinically, but there are different ingredients in the currently licensed Johnson & Johnson vaccine than the other vaccines. So I'm assuming you think you're allergic to whatever it is common to both, but just be aware there are differences in constituents in those two vaccines.
Thank you for that added information, Dr. Douglas. And I would like to ask you, Doctor, to share some parting thoughts as we wind down this call.
Sure, Dirk. Thank you. Well, first of all, I want to thank everybody who joined the call. I appreciate the really fantastic questions that we got. I'm sorry that we didn't have time to accommodate all of them. I do think that we are in a more challenging time with COVID, but I think that we've got the tools available to us. The vaccines are the best tools. We've got 3 good ones. We'll be getting other ones soon. We're learning more and more about how to use them effectively. We have other tools that we can use. Our old friend, the face mask, good ventilation, enjoying the remaining warm weather and maximizing that as much as possible, being sure we test when we get sick so that we can avoid being around other people and be isolated and not go to the grocery store and church. I think we have a lot of tools at our disposal, and we are going to be able to get our lives more and more normal. I think our challenge now is using the tools and trying to stay as positive as we can given the long onslaught that we're dealing with. I really would have to say that I am buoyed as a public health director by the conversation this evening because I feel like we've got such a smart and engaged group of residents in Arapahoe County, and I'm really glad I could be part of this tonight.
Thank you very much, Dr. Douglas, for your time and insights. And Melissa, thank you very much for your time and insights. And thank you to everyone who participated in tonight's Teletown Hall. As a reminder, we'll post a copy of this to the Arapahoe County website in the next 24 hours. We hope you have a great evening. Good night.